Hey there, Dr. Zimmerman here. Today we're going to talk about piriformis syndrome. We're going to be talking about the do's and the don'ts for people who suffer from this condition. And also we're going to be talking about the chiropractic mechanics on how to fix it. But first, let's take a look at a little anatomy. This is the pelvis right here. These are your hip joints, the ilium, called the sacroiliac joints right here. Your butt cheeks are on either side. And we have muscles in here. This is your smallest gluteus muscle that attaches from the ilium down to the femur joint. And then you have your piriformis muscle, which connects right here in the ilium and goes across to the femur joint. What happens is you have a nerve, and they cut the nerve in half here, but this is the sciatic nerve right there. And the sciatic nerve pierces through the piriformis joint, runs through the hip and down the leg. So when the piriformis muscle is overly contracted, it squeezes the sciatic nerve and you get sciatica. So one of the most common causes of sciatica is pelvic misalignment affecting the piriformis muscle, because it's going to squeeze that directly. And then it's going to have an effect on the hip here, because the piriformis muscle is attached to the trochanter, and it's going to cause the hip to pull into external rotation, and then the sacroiliac joints out of alignment. So we got a whole mess. So what we're going to do next is we're going to take you into a room and we're going to show you how the chiropractic approach to centering the pelvis and working on this condition is. All right, so as we were talking about with the model where we were showing you the pelvis and the piriformis muscle, it's all about the pelvic alignment here. So the chiropractic approach is we have to straighten out the pelvis to get the piriformis relaxed. The other problem with the piriformis muscle is the hip joint, the femur joint. We can have external rotation and internal rotation problems. Let's say you injure your hip and you injure it and it causes an internal rotation problem. The piriformis now gets stretched from that, and that causes sciatic nerve irritation when it's stretched. The other issue is when the pelvis is out of alignment here and the piriformis contracts, it's going to pull the femur joint into external rotation, and that's going to keep the piriformis tight and grabbing the sciatic nerve, which is sending the symptom down here. So in this case, we have it coming from the sacroiliac joint being out of alignment and the ischial tuberosity, and we got sacral rotation going this way. So what we want to do is correct that, and then since those are the main issues, it's causing external rotation here. So that's what we're going to do, is we're going to fix that. So the first thing I want to do is I just want to loosen up that piriformis muscle by getting in here with a little vibrational massage and digging on it. I'm not doing this as a massage therapy. I'm doing it more as an acupressure and to increase circulation. So it only takes about 20 to 30 seconds to do the acupressure and increase the circulation. Naturally, if I was doing it as therapeutic massage, I'd spend a lot of time there. But you'll see in a minute, we're gonna do a couple other things to get this muscle loosened on the same vein as acupressure and trigger points, things like that. So that's enough there. So what we're going to do right now is we're just going to put my elbow into that spot and press a little bit and hold it for about 10 seconds. I know this doesn't feel the best, but it feels good when I let go. That's the 10 seconds. So now we're going to do a little active release on that muscle. We're going to put a ball attachment on here. We're going to get on the piriformis muscle, and then we're going to flex the leg up, and we're going to work on it in external rotation. We're going to externally rotate the hips, just relax the leg. We're going to go back and forth like this. Working on that piriformis muscle. And now we're going to go internal rotation. We're going to go this way. Good. Relax. And now we're going to center the pelvis. So we're going to do 3 drops on the sacroiliac joint and then pushing up on the ischial tuberosity like that. And then we're going to take the sacral apex, which is rotated to the right, and we're going to push this way like this and get it back to the midline. And that just needs a little more oomph to it. So we're going to take the old mallet and chisel out. And this is chiropractors don't own the rights to this technique because they've been doing stuff like this since the ancient Egyptian times. And we're just tapping on the sacrum to get it to move a little further. Same thing here on the sacroiliac joint. Good. And now we're going to work on the femur, and we're going to do the external rotation. So this arthrostim instrument is putting the directional force into the femur joint in internal rotation, which is the opposite of the external, which is pulling. And then we're going to back it up more with the sacral apex right. And we're going to go like this. All right. So that's the work we do to center the pelvis, to relax the piriformis muscle. Again, we'll show you some do's and don'ts as far as exercise and what we need to do to strengthen this area to help the problem heal too. All right, one of the things you definitely are not going to want to do when you have piriformis syndrome, active piriformis syndrome, is stretching. This is the typical piriformis stretch, where you go like this, and you hold, and you can feel that stretch and pull the piriformis muscle right here. But you don't want to do that. This is definitely a no, despite it feeling really good, because it's aggravating the piriformis syndrome. It's pulling it more and it's into the nerve, so it's no good. So let me show you what exercises to do. All right, so what you really want to focus on when you have piriformis syndrome is you want to focus on isometric exercise. You really have to get that muscle to contract. It'll help flush out all the toxins in that area. So the best thing to do is you're going to get into a lunge like this. Get your foot at back, 45-degree angle. Bend your body like this. And then you're going to come over here. You're going to put this hand here, one hand on your piriformis, and you're going to rotate away into it. And you're going to hold for about 30 seconds. And that's the isometric contraction. Now why I do it here next to a leg press machine is for balance. If you have a balance issue, you could always reach a hand out and hold it like this. And then you could always catch yourself. And then you'll turn around and you'll come around to this side.
It's like that.
And you'll do this. And you'll get down and you'll do the opposite. And you hold and you pull and you hold 30 seconds like that. And you just hold it, and that's the isometric. And it stretches. It doesn't stretch it, it contracts it, which helps. All right, so let's show you a double exercise where you can do the same thing if balance is an issue. Not very good at this, but you squat down, get into a squat, grab the knee, grab your piriformis, and then rotate again away from it and hold it like that. And it's contracting. Your whole area, this whole area is tight. It's really contracting hard. So the isometrics is key. And that's it for the do's as far as the exercises go. Okay, so one of the last things we want to do and cover in this topic of do's and don'ts for piriformis syndrome is the foam roller. Foam roller is very important. You want to get on your piriformis muscle and get it right over the top of that roller and roll back and forth and dig in. That rolling action with the pressure is getting the muscle to relax. It's working on the trigger point. It's going to get the lactic acid out of there, and it feels good. It'll help with the pain. The other thing are the handheld massagers. This one I found that have multiple attachments on it are real important. I'm going to turn this on. We have a flat surface area that can cover a wide area, so you can get in there and get the blood flowing. But then when you want to dig in, just like with the foam roller, you can pick various tops. Here's a wider one where you can just get in and go back and forth. And then if there's an area that you want to target, you can use the point area and get that in there and just really push it in hard. And that will really break up that muscle contraction and help the muscle loosen up and the adjustments hold and all the isometric exercises we talked about to be effective more to help you out with this piriformis syndrome. So those are the last two things I wanted to talk about.